on YouTube.
Okay. Let us start then.
Okay, wait, sir. Okay.
Whenever you want me to start, I'll start.
मेघा दीदी, सर आप स्लाइड को हटा दीजिए तो हम मेघा दीदी को कर देंगे. If you stop sharing the screen.
Should I stop sharing the screen now? Yeah.
Yes, sir. Yes, sir. Yes, sir.
Stop share. Yeah.
Yes. Megha Di, please take the charge.
Okay, thank you, Ravish. A very good morning to everyone. And I would really say that at this time of COVID-19, we have come up with a topic which was really demanding by all the members, family and everyone, because we have been hearing a lot of news. We have been reading a lot of articles through various sources, but exactly who would be resolving all those little queries which we have in our mind. So for all those things, we have a solution today. Today, I really warmly welcome on behalf of our Lucknow branch, Dr. Mayank Somani, sir. A very good morning, sir, on behalf of all of us. And we will really appreciate, we are very happy that you have given us your precious time at this moment, when I really feel that whether it be doctors, the helping staff, the police people, or anyone who is actually into this line of helping people, not seriously, they have kept their family also very secondary at this moment, which is a very, very, very big, I think, thing which they have done it right now. At this time, you're giving us your such precious time. So thank you. Firstly, I would say thank you for this and a very warm welcome. I would not take much time because we would really love to hear you, and there will be many queries which we will be sharing it with you, sir. So sure. I welcome on behalf of Rahul, Ravish, and all the other members who are part of this lecture today. So I welcome you once again, and I request you to please start your session.
All right. Thank you. Thank you, everybody. And I'll just quickly start the slideshow. Just give me a moment, it takes time to load. Yeah, good. So can you see the first slide, all of you?
Yes, sir, it's visible.
Okay, good. So thank you, everybody. Thank you, all of you, to invite me here to share our thoughts. I have structured the whole presentation. There will be general information regarding Corona, COVID. Most people know it, but still just to cover it up and be on the same page of understanding. Then there are some myth busters. Then what to do with ourselves? What can we do? There is a lot of talk regarding that, whether I should, what are the preventive measures which I can take, which I shouldn't do, should do. So I've covered that. And then eventually at the end, as time permits, we can take some questions and one by one can be answered. Will that be all right?
Perfect, sir. It will be perfect.
Yes, sir.
Yeah, so I would prefer that once I finish, people who have questions on a given slide or want to understand more, just wait out till I finish my presentation and then we take all the questions. So I'm starting. So that's me, just to quickly give you an idea as to I've done my MD Medicine, then I did my MRCP, and then I did my FCCP US. So, see, the literature here is from reliable sources and is largely reproduced. None of this is my own opinion. And with a constant stream of new information and data, which is coming around the novel coronavirus, The knowledge is so rapidly increasing and changing that what we think or do today might not be the same 2 months hence. COVID-19. Now, everybody knows this, everybody's heard it. It's an infectious respiratory disease caused by a coronavirus group. It's a beta coronavirus. Such viruses were already existing. It's the same sister family of the common cold, which we've been suffering from, hearing for such a long period. So this is one of the types, but it is very infectious and a little nasty one as compared to the previous ones. Has a very rapid infection rate, so that's the reason why we all are the way we are today. Origin bats, however, we don't really know what has happened, and research is still going on. What are the symptoms? Well, most people know this, but just to quickly, go through it: high fever, sore throat, persistent cough, nasal congestion, aches and pains, shortness of breath, and some people also have, say, diarrhea, nausea, and muscle pains. Now, a lot of people have been talking about this incubation period. Now, incubation period is a time when you're exposed to the time when you have illness. Now, there are a lot of understanding on this which is required. Less than 14 days is considered to be incubation period. Average is 4 to 5 days. That is the time you're exposed to the time you start showing symptoms. However, there are people, 80% of them, who do not show the symptoms. And still, these are the very people, the 14 days are the quarantine period for those who are exposed and have a clear contact, and that's why it's considered as 14 days. And then there is a lot of question as, suppose if I'm suffering, what really happens to me? I mean, when do I get all right? Usually, the recovery time is around 2 weeks for mild infections and 3 to 6 weeks for severe ones. So unless you are that critical that you go onto a ventilator or really require prolonged ICU care, usually even severe cases get all right in 3 to 6 weeks. Now, what is the spectrum of illness? The spectrum of illness is, this is something which everybody should know and understand so that there's lesser panic around it. Mild, which is like no symptoms, or very mild symptoms, you just have one of those off-hand fever for 3 to 4 days or 7 days and you get all right. And that's in 80-81%. These percentages are different for different countries. We respond differently, but largely this is what it is. Severe disease is in 14% with breathlessness and decreased oxygen blood. A doctor will test that. And then there is a critical disease where there's a lung failure or a drop in blood pressure, which we call as shock, or a multi-organ dysfunction. All your organs are conking off, like a liver dysfunction or a kidney dysfunction. That happens in a 5%. But overall case fatality rate is 2.3%. Or, the different countries different. Currently in our country, it's around 3. So, but no deaths are usually reported among non-critical cases. So we're looking at a problem among those 5%, and those 5% are also having other problems, like age is not on their side, there is a heart disease, there's a lung disease, there's a diabetes. So those are the patients which already have decreased immunity, are the people who are having and that's the population where we are looking at deaths. So when to seek medical care in case I show a symptom? So when do you want to go to a hospital? It depends on, if you have mild symptoms, slight cough, mild fever, then you can stay at home, self-isolate and monitor your symptoms. Severe symptoms, very high fever, persistent cough, throat pain, difficulty in breathing, especially difficulty in breathing. Then pain, pressure in the chest, sometimes severe diarrhea. That's a time when you should see immediate help. Having said that, I'll just come back to the previous slide. I am getting a lot of people who are having a corona fear. They have symptoms, but not corroborated by their physical findings. Some of the patients say that I have breathing problem, but we don't really find one in them. And that's also something which is happening very commonly. However, you should still see a doctor. So how does this COVID-19 spread? So largely it's only person to person through the respiratory tract. That is, people who are coughing, sneezing, or even breathing, and they have the droplets which come out of their tract, and somebody within the range, which is usually less than 6 feet, also inhales the same droplets infected by the COVID-19. And sometimes it can spread through a surface. So somebody sneezes on a surface, leaves the droplets with infected particles for COVID-19, and somebody else touches them, touches their face, and eventually ends up inhaling those droplets. And they are so micro droplets that you can't really see with your eye. So this is how the spread happens. There's no other way till now which is known to spread, but that's the basis of the social distancing per se. Stay away from 6 feet, do not touch other things, and then you might be able to save yourself. What is community spread? And this is one of the important things to understand. See, community spread, which as per today's Indian government claims and information, that we are not in the community spread phase. So we are only in the contact spread phase. That is, that once we know that X person is having it, and it can only happen to me because I know that that person has it. However, what community spread means that some gentleman gets COVID-19, gets infected, gets symptoms, and he can't trace back where did I get it in the first place, which translates it's already existing in the community so much that you can't really backtrack and trace as to which person was responsible for this. And that's the time when it is very difficult to control the epidemic. Once we enter into community spread, that spells trouble, all capitals. So how is COVID-19 tested, diagnosed? See, we have tests now, and the availability of tests is still a challenge in India, which has to be increased. But largely now, government agencies and government hospitals are testing, and some private labs have also started, especially in Lucknow. I think there is some delay in another latency of another 7-10 days, but I think even private labs will start. And that's largely what is done is that, there is a swab taken from your nose or throat, or there's a mucus sample which is available, and then that is tested for the RNA which is there in the virus. And sometimes a blood test can also be done, checking for your antibodies, but that's usually once you have symptoms and illness. But if you want to know in the asymptomatic phase, where you do not have any symptom and you still want to know whether I have contacted COVID-19, then it is the PCR, RT-PCR, and through your swab from the nose or throat. Is the test result final? Sometimes I'm asked this question, is the test result final? Now, every test has its limitation. So there's a false positive and a false negative. And I want all of you to understand this. A false positive means that somebody who do not have the illness, do not have COVID-19, still turns out to be positive on the test. And that's because the test is reading something which has its limitation. And usually, see, the test usually picks up 95 to 99% cases right, but sometimes it can pick up wrong also. So one should know this. And similarly, a false negative. Somebody has the illness and still the test cannot pick it up. And both these things are possible. So a test result is not the final authority that I've got tested, I was told I'm positive. That doesn't mean that you are positive. You can repeat a test to get better output. And that's why people are asking that if you really want to call yourself negative, get a 2 tests done after 24 hours, at a gap of 24 hours. Similarly, false negative, you still have the illness. So sometimes doctors, they take a call that, he still looks like a COVID, and though his test is negative, but I might as well better treat him like a COVID patient. So can COVID-19 be caught from a person who has no symptoms? Somebody is randomly walking and or at home and he has no symptoms and never had any symptoms, and even after exposure he never had symptoms. Initially the question was, people were iffy and not very clear whether it is possible or not, because he's not coughing, he's not sneezing, doesn't have symptoms. But the latest is that yes, the asymptomatic people who do not have any symptoms can also transmit COVID-19, and close contact with such people is again responsible. So we again turn back to social distancing. 6 feet is important, irrespective of whether you have illness, you don't have illness, because if you do not have illness, you still might be carrying COVID-19 because of your asymptomatic phase of COVID-19. Now, this is important and everybody wants to know this. And I've elaborated this a little more than my other slides. What to do if I have come in contact with a COVID-19 suspect or a patient? What do I do? Well, self-quarantine for 14 days. That's the incubation period. If you will have anything, it will show up. Until that time, you self-quarantine yourself and then don't expose others. And even at home, keep a 6 feet distance, even from your family members, because you don't want them to get infected. Do not touch the surfaces which they touch or which you touch, so they detect, they don't touch. So it's like a no-touch technique between you and your family members as well. And then wash your hands fairly often. Do not touch your face. Monitor your symptoms daily. See if you have any fever, cough, throat pain. Report to the government agencies and tell them, like, I had a contact, I had a close contact with a COVID suspect, and I think I'm having symptoms. And also, if you just have mild fever, don't ignore it, because we are in a country where malaria and dengue are also common, and you might be thinking that it's one of those fevers which is suspected to be a COVID and I am otherwise all right, but you might be having other things. So it's good, if you have fever, to reach out to a doctor. Now, what's the difference between distancing, quarantine, and isolation? What is it? People keep talking about it. Now, physical distancing is like being physically apart, a general measure that everybody will have to take from here and for a fairly long time. It's not that, we're looking at flattening the curve and it's going to go away. I think that's going to be the method of life. So we should all get up and have this self-discipline that I'm going to stay away 6 feet from everybody else for my own good self. Then quarantine is somebody is exposed but not sick, not ill. but he can still get sick, in fact. And moreover, even in an asymptomatic phase, he can possibly infect. So they quarantine themselves. They just self-quarantine at home or at some places where the government has made facilities there. Now, then comes the isolation. Those who are seriously ill or significantly ill, then they are the people who are actively responsible for making others and they are really infectious. So they are the people where we should make sure that they are isolated completely. They can't stay in a home and infect all their family members because they're actively coughing or having a high grade fever or sneezing. And those are the things which really need attention. So another question which comes to everybody's mind, can someone who has been quarantined spread illness to others? Oh yes, because now we know that 80% of those having COVID are asymptomatic. In India, it's 70%. So those who still are breathing and some of the droplets because of close contact can be exhaled and somebody else can get that. Can coronavirus be spread through food or packaging? Now, this is one of the very important, query which a lot of people have. खाने से तो नहीं हो जाएगा, पानी से तो नहीं हो जाएगा. No. Till now, there is no evidence whatsoever to support that there's a transmission of COVID-19 through food or water, eating food or through drinking water. No. However, food can still transmit? Oh yes, you buy some vegetables and somebody else who was COVID also was buying from the same vendor. And then you end up touching those vegetables and touching your face and eventually getting it. Yes, possible. Or the surface, food packets, milk packets, so vegetables, fruits. So preferably, wear gloves, don't touch your face, wash vegetables, clean the surfaces. And it's always important to keep washing your hands with soap and water. That's something which is good in general. I'll just take a break here. Admin, can you hear me?
Yes, sir.
Would you want me to slow down?
No, sir, please go on. The PPT is pretty good. We are actually enjoying the deliberation from you, sir. We are getting some questions. We'll take it post your presentation is over.
Yeah, that's all right. But I just wanted to know if the speed is all right, because I don't want, you couldn't say and I didn't know. So
it's perfect, sir. It's perfect.
No, sir, it is perfect.
All right, good. Now, this is something which is a very important slide from my perspective. Should you donate blood? Will it transmit? Not known. Should you donate blood? Oh yes. The demand for blood and other diseases are not going anywhere. People are still having anemia. People are still bleeding because of various other illnesses. So where does the blood come from? The blood, there's only one source, humans. So donating blood is still life-saving. Do not stop. Please go ahead and donate blood. There are a lot of patients who are requiring it. And actually, blood is becoming, availability of blood is becoming a problem. Even our own doctors and staff donated within the hospital so that we could, support the patient inflow. So I would strongly, strongly request everybody to keep doing this, irrespective of lockdown, irrespective of your fears, and go to a good center. We are also doing it, and we have all infection safety protocols. So don't worry, go ahead and just donate blood wherever you can. Then there are a lot of people who think that, I wear contact lenses, should I? Eyeglass wearers, Should I take any special precaution? Not really. The same, wash your hands, clean your, safe wear and care hygiene. That's largely important. Clean your glasses properly, clean your contact lenses properly. There's nothing like, you really need to do anything specific. Do what you've been doing, but just the same universal precautions. Clean your hands, clean your face, clean your, glasses, use sanitizers, soap and water wherever it's required. Now, preparing your home and family for COVID-19. This is important. A lot of people ask us, "Hum kya karen ghar pe?" What do I do if someone in my home has COVID-19? Say somebody has it, it's turned positive, doesn't have illness, doesn't need to be in a hospital. He can still be at home, quarantined, or just home care. So keep sick persons away from those who are affected. Just keep all your elder people or sick people away. Have them cover their face. While doing sick person's laundry, avoid letting it touch your body and do not shake it. Like, जैसे हम लोग हिंदुस्तानी तरीका ना धो ही डालेंगे नहीं. Just leave it in warm water and clean it. Don't really bother about really cleaning it. Like, use disinfectants to clean surfaces. We all know there are a lot of disinfectants which are now government approved. They should have X percentage of alcohol. They should have these properties. It's all available everywhere. So I'm not going in details of that. Wear disposable gloves when you can, because when you are using various things, wash hands often. This is important. Now, if you have a separate bedroom or a bathroom for a person who's sick, brilliant, best. So, largely you have to, एक तरह से हम पुराने जमाने में कहते हैं ना कि काला पानी दे दिया एक कमरे में. So that's what you have to do for 14 days. It's not that bad, trust me. We still have internet and various other things to, be connected. So only clean the area around the person who's sick if it's really required. You don't have to do it कि भाई इस कमरे में अब आज सफाई करने ही बैठेंगे. You can just go slow on that. Don't really need to clean. And if the person who is COVID-19 positive, if he's okay, then that person should clean it, everything himself. Don't ask your family members to do it. If shared bathroom, then the person who's sick should clean it, disinfect it, and then come out. If it's not possible because they're sick, in that situation, most of the time they will be in hospital, but just in case if somebody's home and is, suffering from just fever and cough and still at home, then the caregiver should wait as long as possible before cleaning and disinfecting, because the COVID-19 stays on the surfaces for a limited period of time. So which I will also take up, but that's what it should be done. And, send the food to the person in the room itself, wash dishes and utensils using gloves and hot water, and dedicated linen. It's linen, it's not, there's some dedicated linen trash can so that, the trash can is separate only. And again, somebody uses the gloves and, trashes it properly. Now, we should get prepared for a community spread if at all it happens. God forbid it shouldn't, and God bless us that we are able to ward that off. But just in case, let's get prepared. What are the do's at that point of time if there's a community spread? Do's are social distancing. There's nothing you can do. If it's already there in the air, largely, nobody knows where it's coming from and how can I get infected, then it's an intense lockdown situation. A lot of people think that once community spread starts, then there's nothing to do now. It's already there. So why should we? Then things will open up. No, it's not that. I think it's going to be even more intense lockdown. And then keeping the 2-meter distance is going to be the thing, the 6 feet, and then stay home. You can't really do anything. It's all everywhere then. So that's the importance of social distancing. before this, I just want to make, one thing understandable as to why is it that we are doing all this? Why social distancing? If it's already spreading, if it's already picking up people, then why are we doing this? Is because the rapidity at which this illness spreads, it's overwhelming for a family, for a state, for a nation to take care, for doctors to be around, that many doctors, that many. So that's the problem, that the level at which it just, you know, uh, gets to, it's way too much. And that's going to be the problem. So I'll come back to this again in my future slides. Now, face masks, cloth masks have been advised by WHO, CDC, everyone now. And people are thinking that I'm putting my cloth mask and everybody's putting a cloth mask and thinking that this is going to save me. No, it's not going to save you. It's for a community setting. And what it's going to save is, suppose if you are a carrier and you are breathing in asymptomatic phase, most of them will be blocked by your cloth mask and will not affect somebody else who does not have it. And hence, this is to protect the people around you rather than yourself. But if everybody is having that, so we are creating a kind of community protection. Everybody is protecting the other person. So that way, we reduce the community spread. And that's what is important. So cloth mask, yes. Why? To save others. But when everybody is saving the other, everybody is saved. That's what is important. N95 masks, a lot of people want it. A lot of people are buying it. They're buying it at obnoxious prices also. But are they the good ones? Are they the Chinese ones? You really need to know which ones to buy. And there is a clear government agencies which have told that these are the kinds which have to be bought. And then why are they're already in short supply. So they should be reserved for healthcare workers, also the patients and other people who really require it. The elderly, the people who are in hospital for diseases other than COVID. So there are a lot of patients who are other than COVID as well. Heart attacks and strokes and various other things are not going anywhere. So that's where, and we shouldn't run out of the masks so that the healthcare workers per se stop treating people, because this is how can I treat a person when I am myself exposed? And even if he is ready to treat without masks, eventually he will get sick and he will not be available to treat. So that's the most important part. So what this is about masks. How to treat, we've gone through the whole thing that, what is COVID, how are the symptoms, how does it spread, what can we do, what are the prevention, what about treatment? So is there a medicine? Is there a vaccine? No, both are under development. So till when is a very, very frequent question which I get. All I can tell you is speed of medical innovation is encouraging, but not to dissuade you. Our history has been that it takes about 4 to 5 years for any vaccine or treatment to actually crystallize. That's the history. But now the speed of medical innovation and the way it is, everybody is trying to do something. And there are various kinds of reports which keep coming through. Maybe in 3 months' time, we might have a vaccine. In an X medicine has a lot of value and might be able to use. And you've all heard, I'm sure, about the malaria drug, the worm drug, which was recently spoken about. And then there is another drug which was used in Ebola, which is being talked about, and a vaccine. Let me make you understand quickly. This really needs understanding from common people as well, besides the healthcare. Now, see what happens is you develop a vaccine And then there is a chain of things, the phase 1 trial is say in mice where you test them, and then you test them in mammals, monkeys, and various other animals, and that's called animal testing. And then you test in humans. And you don't want a vaccine to have a late side effect being given to the entire human race. You understand this, please? What happens is you test a vaccine and to go ahead with for human trials once you know that the kidneys or liver or brain is not malfunctioning in another mammal, and that also needs time. Say some say you give it to some animals and see for 6 months, 9 months, 12 months that there are no side effects, no prolonged side effects, and then you give it to humans, and then limited humans who are volunteering, and then you test them for a year or so and make sure that they do not have long-term side effects. Short-term are different, long-term are different, and you don't want to skip this. Say you skip this today, that you didn't wait for all the side effects to happen for a year, and after a year we come to know that there are significant side effects. Then you have already inoculated the entire human race with a given medicine or vaccine. You don't want to do that. You can't skip it. So yes, there are a lot of promising. So if we already have a previous drug which can act now, great, then we have some treatment. But everybody's trying that any previous drug, any other antiviral drug which was there in the past, if that can be used, brilliant. That's what all of us want. And God bless us if we can find something in 1 month and then we are back to our own lives. If not, then we should understand that we have to wait out this period so that the medicines are tested accordingly, and similarly for the vaccines. So till when? Well, sometimes I get encouraged by some reports which is months. Sometimes I get depressed and dissuaded because sometimes it looks like a year or 2 or 3. So we don't know, but both are under development. So what to do till treatment arrives? And this is what is important. And please, all of you, please listen to this. What to do till treatment arrives, the vaccine or the medicine? Intense suppression strategy. Do not let it run wild. And that's the hammer which we need to put on the whole coronavirus, the COVID. We just need to hammer it. And how do we do that? Intense social distancing. We don't let it spread. Just not. And then do we do a mass testing and isolating? You find somebody who's having a COVID, isolate. So he can't spread it. And then in 14 days, that COVID particle dies in that person, and that's it. So that person comes back and then again practices social distancing. So intense suppression strategy is what we have to do till treatment arrives. And it has to be an absolute self-discipline. Just do not blame or reward a PM. He said lockdown. So there are a lot of people who think lockdown's right, lockdown is wrong, there's economy, there's this, there's that, there's difficulty. Hello, this is all you're doing, everybody is doing for themselves. So let's not start blaming or rewarding a PM for this. This is common sense. There is a disease which is running wild. We need to suppress it. The suppression is our own discipline. We don't meet people who have possible suspects. We have intense social distancing. And then eventually once we have mass testing and then we start isolating people, then we will be able to have a better control till the time treatment arrives. But till that time, this is what life is. Keep doing the social distancing. So till when the lockdown, given this kind of information which comes through? Well, when the rate of infection slows and flattening of the curve happens. Everybody has now heard of flattening of the curve, that that there's a curve which is very steep and everybody's getting infected. And instead of this large curve, we want a smaller one. So, and that's, lesser number of infected people. So if you look at our lockdown, so if you look at an American lockdown, So they also are under lockdown, but they are having 30,000 patients, 25,000 patients every day being infected and kept coming out positive. We only have about 1,000 to 2,000. So isn't it working? Oh, yes, it is working. But till when? Nobody has the right answer. We just know that, till we think that it is flattening the curve and no fresh cases are appearing, people have understood the self-discipline. There are a lot of people who want to break the discipline, but there are, that's why it's an intense lockdown where the entire population has understood the use of masks, the social distancing, reporting, getting themselves tested, isolating themselves. Those are the countries like Iceland, Taiwan, to a certain extent South Korea, Japan, Germany. Despite a very high number, they are releasing their lockdown because the general public has taken up on themselves that it's my duty to save myself rather than expecting a state government, a central government, a PM to do anything for me. And that is what is the most important part. All the nation is doing at this point of time by giving you the lockdown is to prepare for the infrastructure to deal with a calamity, in a catastrophe that there are thousands of cases happening. What we need is a good number of hospital beds, good supply chain, good material, PPE, treatment, whatever, ventilators. So that's what the lockdown will prepare us for. Lesser number of cases today, keep preparing, keep ordering the various supply chain, ventilators and everything so that whenever overwhelming numbers happen, we are well prepared. Oh, what's expected then? What does one do now? Whatever. So there will be some months of lockdown. The general consensus is that 10 weeks to 12 weeks is a good lockdown period to suppress it. If people are listening and are self-disciplined, and then gradual opening and see how people behave. It has nothing to do with a state government or a central government. Please be very clear on this. And then evaluation. The government is only going to evaluate how many cases are happening, and if people are not able to control it themselves by isolating or social distancing, then there will be a rise again. And hence, we are looking at a periodical lockdown. And that is what is a possibility till the time treatment arrives. So people do call it as a W, inverted W, that it rises, goes down, then again comes up, and that's how there's a possibility. A periodic lockdown looks like a reality. Economy. So what will happen to economy? There's another question. Whenever people talk about lockdown, people talk about economy in the same vein. Well, nobody has the right answer. Seriously. Even government or anybody. There's no specific exit strategy known to anybody. There's no known sweet spot to work with. There's no history. People just know. People are just trying to see what has worked at some place. And what has really worked at the end of the day is self-discipline. And countries like Taiwan, Iceland, Germany have controlled the pandemic. And there are lessons like mass testing, isolating, and self-discipline. But having said that, even these countries, what's common even now is social distancing and masked humans. Everybody has to be masked. That's the continual reality. It's not going to stop till the time we have a vaccine which prevents everybody and we win over the COVID. It will happen for sure. But when is a good question which nobody has a clear answer to. We can just wait. Another thing, because now a lot of people are already infected, and so people think that those who are infected have immunity passport. That's what I would call. Immunity passport means that, see, I am free to do whatever I want to do because I had COVID. I went through my illness. No. The latest reports is suggesting that possibly those infected ones can get reinfected and the antibodies may not necessarily make them immune forever. So one has to be careful and continue to stay safe by doing what they were doing in their pre-COVID time. So somebody who has had COVID should not think that I have the immunity passport to do and roam around and do whatever I can, because I can't infect and I can't get infected is not truth. I'll quickly talk about some special population. Children, a lot of people, everybody has one or two in the family, and then they're worried, ki kya hoga? So are children immune to corona? No. Do children have different symptoms from adults? Largely not. They're very similar. Generally, children have milder symptoms. And can children be carriers? Yes. So you can't assume that they do not have much illness, so they will not be carriers and they will not infect others. They will. And they also should have mask and all, except for those who are younger than 2 years. Younger than 2 years, the WHO still says, do not give them a mask. We do not know what breathing difficulty when can get tightened and, suffocation can happen. But greater than 2 years, everybody should wear a mask, irrespective. Pregnant women. Can COVID-19 be passed from a woman to her unborn or a newborn baby? No, we don't have this evidence that it can transfer vertically, that is from mother to the womb and to the kid, or through breast milk. It can't, as of now, till that, no evidence till now. However, once the baby is born and if mother is infected, per se the same method of infecting through the droplets, through the respiration, the breathing, it can still happen. So the mother has to take all precautions while breastfeed. She should breastfeed, but all precautions, wear an N95 mask, and then all respiratory hygiene, do not cough, be very clear, sneezing, in the proper tissue, discarding it, all of that has to happen, and handle baby only after washing hands and being clean. Who are the people who are at high risk? A lot of people have started asking, who is at risk really? Is age the only thing? No. Age is one of the things. Greater than 65, yes, we are looking at a increased possibility of serious illness. Then somebody already has a prior lung disease, because corona in its severest form is affecting the lungs the most. So yes, previously lung disease, a heart condition, or somebody whose immune system is already compromised. Somebody is on cancer therapy, or somebody has HIV, somebody is on organ transplantation, or smoking too much, or taking corticosteroids for other illnesses. They are the people who are immunocompromised, and this is irrespective of the age. But should we stop a cancer treatment? No, that shouldn't happen. We should take, again, precautions and continue to do what we have to do. You can't stop dialysis. You can't stop cancer treatment. People will die of the primary disease itself rather than wait for COVID to happen. So we need to prevent, but not stop their own original treatment. Then people with severe obesity, diabetes, kidney disease, liver disease, they all have increased risk of serious illness. So what do we do with kidney and dialysis patients? Continue the dialysis treatments and maintain the social distancing, hygiene, and everything again the same. Make sure that all the patients wear masks mandatorily. Heart patients. Are patients with heart disease at increased risk of corona? Yes. They're more likely to show symptoms as well as more severe infection. Having said that, is that a death warrant? Having diabetes, heart disease, kidney disease? No. Please make sure that we don't, make our elderly or suffering from certain diseases really depressed that, I am at risk. Yes, they're at risk, but there are a lot of patients who had underlying diseases and they have been discharged after getting fully recovered. So that's also important to understand. Similarly, for respiratory disease, risk of contracting more, is not more, it's the same. But severe illness, yes. And a lot of people do ask us, is there any difference from TB? Of course, there's a difference from TB. This is a short version of a disease. There's a longer version of a disease. And then there are a lot of other symptoms which doctor can differentiate. Not that always. There are some overlaps and sometimes it can be confusing. But COVID-19 is a shorter disease, 7 to 10 days. TB is a longer disease, months. And then there are different symptoms and also some differences on X-rays and various other investigations. Diabetes patients. Are diabetes patients at increased risk? Yes. Do people with diabetes have a higher chance of experiencing serious complications? Yes. And what are the emergency warning signs which a diabetic should know if they have, because they already have certain diseases by which fever and burning micturition, mudding in urine, all of that does happen to diabetics. But if you have a breathing problem, if you have significant pain in the chest, or you are turning blue, and all of that stuff, report to a hospital immediately. This is important. For me, it makes my life easier as a doctor when I tell people not to smoke or chew tobacco. Now, Corona is telling them the same, and they are listening for once. So act of smoking increases the possibility of transmission from virus from hand to mouth either ways. You're touching your face because of smoking, but at the same time, smoking causes reduced lung capacity. So Corona is telling not to smoke. And listen, can I catch COVID-19 from my pet? There's no evidence. So please don't abandon pets. There's no. Actually, the only thing which can happen, which is you're coming to know that some cats, some tigers, some animals have been tested positive for COVID. So you can give COVID from humans to pets. Pets should be afraid of us rather than the other way around. Pets are not giving it to us for sure till now. That's the evidence. How long the virus survives and surfaces is, and this is available on various websites. Everybody knows this, but still just for repetition. Plastics and stainless steel for 72 hours, cardboard 24 hours. Be careful. I'll quickly take up some myths and facts. And this will be a quick thing. Coronavirus will end with rising temperature, and we all expect कि अब लू आएगी तो बस निपट ही जाएगा कोरोना. ऐसा नहीं होगा. You will still catch corona, and it doesn't matter whether the weather is hot, sunny, wintry, snowy. Just didn't matter to corona. So it's not a great information, but unfortunately, this is the truth. So it's a myth that temperature is going to change anything. It can have some variation, but largely not much that we can be enthused about. And generally, coronaviruses survive for shorter periods at higher temperature and higher humidity than in cooler and drier environments. However, there's no definite cutoff by which we can say, "Aisa karne to ho hi jayega kuch." Nothing like that. Another myth is one infected with COVID-19, a person is going to die. It's not a death warrant. You recover, most recover. There's only 2%, 3% death. And that also in somebody who's already deceased. Holding breath for 10 seconds means I'm free from COVID-19. The people have started self-testing that I can, do a breath count by holding, and it doesn't look like that I have one, nothing like that. Consuming alcohol will protect from COVID-19. This has been propagated a lot by largely who are fond of alcohol. I'm sorry to, dispel this to them and others that alcohol will not protect at all. Nothing. Taking hot bath can prevent me from COVID-19. Really, even if you take a cold bath or a hot bath, doesn't matter. Taking bath just prevents you and everybody else by washing and cleaning your body, and just in case if you have something on your body. That's all it does. COVID-19 can be transmitted through mosquito bite. That's a myth. Don't believe that. There's nothing like that. Hand dryers are effective in cleaning coronaviruses? No, nothing. Only and only wash your hands with soap and water. That will work. Ultraviolet lamps, which have been, off the shelves of the various internet, Amazon and everywhere, and people have been buying that, doesn't help at all. Then thermal scanners, everybody thinks that having a gun in your hand, which has a thermal scanner, and it will tell us the corona. And as soon as anybody finds anybody with fever, there's an alarm bell which goes. But there are a few things which one should understand. Every fever is not corona. Every fever should be evaluated for a possibility, yes. But that doesn't mean that once anybody has a fever. So people are now afraid of giving history of fever. They hide because it's becoming a stigma, so please do not spread it like this. Thermal scanners don't tell that this patient is corona. It just tells that he has fever and he should be evaluated. That's all. Applying alcohol or sanitizer on your body can kill coronavirus is a big myth. Don't even attempt it. Don't do it. You'll spoil your skin. Regularly rinsing nose with saline water can protect from corona? No, another big myth. Don't keep doing various things. Some people have started doing neti and all. कि साहब इधर से पानी डाला उधर से निकाला कुछ नहीं होगा कोरोना को कोई फर्क नहीं पड़ता है. How much water are you putting in your nose? It's just that you breathe, and if it's around, it will just enter in your lungs. That's all it does. You can't wash it off. Eating garlic can prevent corona? No, it cannot. But if you are fond of it, if you like the taste, go ahead and use it. I mean, there's no harm in taking garlic and onion, but not for warding of corona. Coronavirus affects only elderly people? No, it has been reported in babies, it's been reported in young people, it's been reported everywhere. It's just that elderlies are at more risk of serious infection. That's all about it. Antibiotics are effective in preventing corona is a big myth. There's nothing which we can do with. There's no treatment, we already spoke. And then there's a lot of talk, and everybody wants to know, so what is it that I can do? I mean, now it's a game between a corona and an immune system. And can I develop my own immunity to the extent that I can deal with corona myself? Very, very important thing. It's a question on everybody's mind. What can I do? I know there is, there is a corona, there is no treatment. So, but there are some people who get better. Some people, despite infection, do not have any symptom, and some people are dying. So what do I do to prevent myself from dying? And there are so many claims all across. This will boost immunity, that will boost immunity, this will work, that will work. And that's because people are selling hope. So we'll dispel all this, or affirm whatever it's required by scientific data and understanding, so that all of you need to understand this. Can you boost immune system enough to fight COVID-19? A very tough question, but immune system is not, and it's not measurable. All of us have an immune system, and if we are naturally not getting repeatedly infected by various other diseases, then we are okay. Whatever we've been doing in our lives is largely okay. That's the only test, that I don't fall sick every month, I don't fall sick every year, I don't have repeated infections other than COVID in my life before COVID. Then largely it is reflection that you've been doing all right. And there's no test which can tell you that my immune system kaisa hai. I have had a lot of questions on this, and a lot of people come to me to please check my immunity. There's no way to do it. There's not single measure. It's your complete body and how you've been responding to the external stimulus including infective, non-infective, is what your body is. But can you do anything about it? Well, there are things which are indicated, but largely it's not that, maybe some kinds of cells are increased by some vitamin or some plant or herb, but it decreases the other. So we don't know what is the right balance. And to suggest that you should take this and this will boost your immunity is not the right thing. So please don't fall for it. And there's no way to know what's going to help and what's not going to help. So don't fall prey to this. A lot of people have already done that. Things have been, all over the world. It's very common that most supplements have been going off the shelves, and most Flipkarts and Amazons have so many requests for X amount of vitamin C, D, and various supplements. So they're really, it's like 400% increase. It's not really required that way. It doesn't help that way. So let's do some basics here. How to reinforce my immune system. Again, the basics are the same. Proper hand washing, clean. Your whole thing should be clean. And then don't smoke. That weakens your lung. And that's something which you shouldn't do. Sleep. Now we will take few things which are important. A lot of people start asking me, is sleep important? And what should I do? How should I sleep? My system is different. I'm only staying home. I'm locked down. So what do I do? It's a good way to boost immunity if you have rested. If your body is functioning good, then, and one of the key things is sleep. But sleeping extra, more than what you should. Should I sleep 6 or 3 hours to get immunity boost? No. And I'll come back to that. So the notion of optimal sleep is complex, very complex, and poorly understood. Largely people define 8 ghante sona chahiye, and all of us have advised this to 100 times, and we all see it all across. इतना ही सोना चाहिए, तुम्हें 7 घंटे सोना चाहिए, तुम्हें तो 8 घंटे सोना चाहिए, and all of you can identify with this. And this is the amount recommended by various health authorities also. But many dimensions of sleep are important beyond amount. And that is the most important thing which all of you should understand. I'm deep diving into sleep because now this is what all we need to understand while staying at home. So till now, what I've done is I've quickly gone through the basics. Now we're talking about what can we do. So this is what is important. Sleep is not the amount each night. It's a sleep efficiency. Proportion of the time when you were actually in bed and actually slept. Sleep timing, what time you sleep and what time you wake up. And what is the sleep architecture? There are various stages of sleep as well. Stage 1, 2, 3, and 4. And what was your architecture? How well were you sleeping? Then sleep consistency. What is it that you do every day? Sometimes you sleep 8 hours. Next time you sleep 6 hours. Then sometimes 5 hours. Sometimes 10 hours. Versus that, sleep consistency is better. Sleep consolidation. Organization of sleep, the way you sleep across every night or day, whatever your cycle is again. And then sleep satisfaction. What is the sleep latency? Bed pe gaye, kitni der baad soye, kitni baar raat mein uthe, how much, and what are the wake time after your sleep onset, how many times you wake up. All of this constitutes what is the right optimum sleep. So sleep hygiene is what we're talking about. And the bottom line for everybody, whether you sleep early morning, you sleep at night, it's your cycle. So don't fall prey to an amount, the cycle and everything. All you need to do is understand is the sleep hygiene. And that one definition is feel rested when you get out of bed. Whether you sleep 5 hours, but you think that I am ready to take on the world for next 19, you're fine. It's not that their recommended amount of sleep. Yes, 7 to 8 hours is preferred, but they're different. It applies different to different people and different genetics and their own method of life. So maintain a regular sleep schedule, important. Regular sleep-wake cycle, important. Try not to force sleep. Avoid caffeinated beverages after lunch. Avoid alcohol near bedtime. Avoid smoking or other nicotine intake, particularly during the evening. These all do not give a very good sleep architecture pattern. Adjust bedroom environment to decrease the stimulus. A lot of people sleep while their laptops are open, their TVs are open, or radio is there. It's not a good thing. I don't know. People say that I like, listening to music while sleeping. There are definite stimulus, so be careful. You might sleep better without them. Try it. Avoid prolonged use of light emitting screens in general throughout the day. Laptops, tablets, smartphones, ebooks. I know this is the most difficult part. It is more difficult addiction than alcohol and smoking. A lot of you are right now responding, hello, we are okay with giving up alcohol and smoking, but don't do this to us. But this is the reality. Resolve concerns or worries before bedtime. Now, this is the most important. And I don't know, there's no mantra to it. Everybody has worries. Everybody has, conflicts at home, parents, wife, husband, kids. And I wish I knew the mantra. But writing it for me as a doctor is fairly comfortable. Resolve it before you go to bedtime. Yeah. Exercise regularly for at least 20 to 30 minutes and preferably 4 to 5 hours before you go off to sleep. And avoid daytime naps. And people will be surprised by this, that especially if they're longer than 30 minutes or occur late in the day, it changes your sleep cycle at night or whenever, So please avoid the daytime naps until unless it is really, a 5-minute nap or a power nap kind of thing. Anything greater than 30 minutes is not advised. Optimal sleep. The amount of sleep needed to optimize outcomes is, how do you measure what is optimal? Performance, your own performance, your mental health, your physical health, your quality of life. And one study did reveal that insomnia, those who are insomniacs, they had less immune response to influenza vaccine. So we don't know. That's one study. And whether it can apply to COVID, we don't know. But again, no harm in sleeping all right, whether it boosts your immunity, does not boost your immunity, saves you from COVID or not. But you should sleep all right, and that's important. So there's no magic number for the amount of sleep which you should have, 7 hours, 9 hours, 10 hours, but you should have a good sleep which makes you feel rested. Next one, which is exercise. Now, the right amount of exercise shows that there are fewer infections in those who are fitter. Now, the general consensus is that exercise is beneficial, but it's also known that strenuous exercises and when you overdo does decrease an immune function temporarily. So that's something which people should know. And it's been known that elite athletes who overtrain, keep running for 5 hours, 6 hours, they do tend to have infections more frequently. It's been a meta-analysis which has been done. So advice is stay active, but this is not the right time to suddenly start doing high intensity exercise routines. Not right. So this is not the time. Just do it in moderation and you should be fine. So it is proposed that low to moderate levels of exercise may boost immunity through their action of, and then that's all medical jargon, growth hormone and cellular, humoral and all of that. So I would spare you all of that, but yes, it is known. However, these benefits when you do a strenuous extra high intensity, then the exercise reaches a threshold where some steroids are also released, and that can cause a decreased immune responses, and that's not something which you would want today. You can do that, but currently in the face of a pandemic, I think it is best avoided. And then there are other exercise benefits which everybody knows: burns calories, control weight, controls blood sugar, blood pressure, lowers stress, keeps bones strong, and prevention of heart disease. They're all already known. Stress, now. Everybody is talking about it these days. Most of the calls which I receive, most of the conversation which I get, भाई बहुत stress हो रहा है, ऐसे कैसे होगा, economy गई, काम कब करें, lockdown में तो पागल ही हो जाएंगे, मुझे तो कुछ हो रहा है, what is happening to me, what is happening to my spouse, the elders, the children, everybody is going crazy is what everybody keeps telling me. It's something which needs attention and we will look into it. But what is the impact of stress on immunity? And can we really do anything about it? Can we not stress? But, well, there is a data that acute stressors may enhance immune functions actually. Suddenly, agar chinta aa gayi, to kai baar, your reaction from the body is, you want to take charge. But prolonged, it's like, you have some infection once in 10 years, then your body reacts to it and you get all right quicker. And sometimes when you have been sick for 10 years, then your body just can't respond. So you have to understand that we are looking at a very long stress. So we don't have to we have to understand that if we continue to be taking stress, then the immune function may not be at the best. So worrying about stock markets, right, worrying about not having enough toilet paper or not enough stuff at home can actually be very worrisome, but it can negatively impact your immune system. Now, how do you respond to the stress? Some things which all of us should know, most of you know already, but still I'll just enumerate that. You become very anxious, very fearful in general. Something in the back of your mind is always bothering you. Feeling depressed, man acha nahi, feeling guilty, feeling angry, feeling at times even heroic. I am doing this in the face of COVID, feeling suddenly euphoric, extra euphoric. And then suddenly you get into that, but mujhe koi fark nahi padta. I won't care about anything. Or sometimes totally overwhelmed by sadness and you're just so sad that you're not even talking. And these are the various emotions which COVID or not COVID, we've all gone through. But COVID has just precipitated it en masse. Most of you would say, "Bhai, ye kaun si nayi baat bataiye, to mujhe hota hi raha hai, pehle bhi hota raha hai." But having said that, these are the things which one should look at, and possibly this has all precipitated because of the way we are these days. Then how does your even body react? People say कि बाकी सब तो ठीक है, मन तो खराब हो गया, body में पता नहीं क्यों ऐसा हो रहा है, तुम्हें कोई बीमारी हो गई है. No, people can have diarrhea, stomach ache, nausea, vomitings, headaches, body aches, appetite चली गई, or eating just too much, having even sweating. I have had patients who have come to me and said that पता नहीं क्यों अचानक से रात में खूब पसीना आ जाता है. I don't know, having chills, getting tremor. People come with shaking of their hands and stuff, and they say that something's going wrong with me. Or achanak say, so all of this. So we need to, and there can be all the disease as well, but a doctor needs to differentiate and also tell very frankly that these are all symptoms of being depressed or being under stress. Similarly, even your thinking. So what we have done, if you see, we see how body responds, how emotion responds, how your thought process also responds. Have trouble remembering, feeling confused, trouble thinking clearly, not able to concentrate, difficulty in making decisions. And sometimes you say that something has changed, but you're not able to accept it. It's just your stress which is overworking. And how does all this respond eventually? Your behavior changes. You have decreased or increased level of activity. You start taking more alcohol or tobacco, or have trouble sleeping, have a lot of irritability. हंसने में गुस्सा आ जाता है, घर पे बैठे हैं, कोई काम नहीं हो रहा है, तब भी चिड़चिड़. And maybe you just start sobbing, crying, worrying excessively, wanting to be alone, blaming other people. All of this starts happening, and don't find anything pleasurable. Don't fall to this. Now, what can we do? Hit on the reality button first. We can't make this stressful situation go. It can't disappear. Poof. It's not going to happen. What we can do, or we should, is take measures to control our responses. Why I deep dived into stress is this is the most important part which all of us need to understand, that it is a stressful situation. So everybody's talking about stress, and it's not going to disappear. So let's accept it and try to take measures by doing, controlling it rather than just Now, what can we do? And you know what? The funniest part, which is my first point, what can we do to combat stress, is listen to Gyan. There's so much of it. Even I'm doing what I'm doing right now, but all these webinars or the various things which are available across, you can hear and listen and see if it works for you. And then be creative. You've always wanted to paint or do something, and some instrument playing or something. If you can, I don't know. People have various tastes, so just grab the opportunity. Then there are various Netflix and everything. So you can watch movies which you always wanted to but couldn't. And people do respond when I tell them कि भाई कितना Netflix देखेंगे, कितना Ludo और Monopoly खेलेंगे, क्या करेंगे. But you don't have a choice. So make a rhythm with your family. It's good to have old games like Ludo and Monopoly to be played. Work from home is important. If people have that and there is a possibility, yes, it's a great thing. Then you could do an online course. There are a lot of courses which have gone free because of this, and even Harvard and MIT are also offering them. Philanthropy and helping the underprivileged, it gives us satisfaction, and those who want to do it, can do it, should do it. And the last one, which is not the Gyan, which I call it as a Gyan, but then that's most important, is talk, more talk and talk amongst yourself, among your friends. And this whole, being IT-driven society today, with all of us even now being together, is the most important. Talk to your friends, talk to your parents, talk to your children, do things, and this would help. And what else? Seriously, either ways you're locked down. So I know this is all Gyan Baji, and you would say कि भाई ये 3 महीने 6 महीने तक घर में रहो तो समझ में आएगा, लेकिन but there's nothing else which we can do about it. We don't have a choice. So whatever limited choices we have, and people can add on to this list. It's just that I'm just giving you a broad perspective. A quick word on alcohol. If you drink alcohol, drink in moderation, but don't shift to heavy drinking because you're not able to cope up with this situation. Don't do that, because if you fall sick, you will fall significantly sick, and it will be a added burden onto your family as well. So, and moreover, some of you might be saying, "Bhai, mili kahan raha hai?" So, yeah, that's an added advantage. You can't get it, it's good. But if you are having, if it's a possibility then please avoid it as much as possible. And if you have to have it in moderation. Drink for females and 2 drinks for men. Now, once we don't tell what volumes, then people say, "Bhai, ek bada drink bana le, 2 drink to bataye hain." But you should know for your own body. You shouldn't do it. 30 ml 30 to 40 ml should be considered. A lot of people will contest for 60. I would still recommend 30, 40 as a drink. And then there's a lot of fad about low carb, keto diet and all of that. And a quick word in that. There's a conflicting evidence on health benefits of eating low carb. People, both kinds of diet physicians are contesting. Some say adequate carbohydrate, some say low carbohydrate, some say keto diet, and there is an ongoing contest. I think the sweet spot is have a balanced diet is what I would recommend. A lot of people will keep asking. Your blood sugar should be in check if you're a diabetic. Your blood sugar shouldn't go overboard if you're not, and you don't want to end up as a diabetic. So whatever is required as a robust system of right amount of balanced diet and exercise, which keeps your blood sugars in check and your weight in check, is what is important. Otherwise, there's a lot of data. Somebody can come up and send me a white paper or a general information on the internet that low carb nutrition will increase and boost the immune system. I can send back various other data which says that it will harm the heart. So there's so many conflicting reports. So don't fall for it. Please stay the way things are best done till now, which have been known, is a balanced diet, and that's where you should stay, is my opinion. Supplements. Dietary supplement sales have surged nationwide. Jisko dekho, they're stocking up vitamins, herbs, extracts, cold and flu remedies. None of these products have been shown to lower the likelihood of contracting the coronavirus or shortening its course. I repeat, none of the products have been shown to lower the likelihood of contracting the coronavirus or shortening its course. Now, on the contrary, taking large doses of them can potentially do harm. So, please do not be desperate just to increase your immunity or a defense system. Just panicking will not help. What will help is social distancing, isolating, quarantining, be careful, and all the preventive methods like wearing a mask, cloth mask, and washing hands. This is not going to do anything much. Please be very, very careful on this. I will take up a few of them just to give you a perspective, because a lot of people ask me, vitamin C le lein, vitamin D le lein. This is no clear answer to it, but still I will give them. I will not leave them hanging in balance here. There will be a clear answer. So vitamin C has been spoken to with everybody for, against flu, against cold, and there are studies which suggest that, it does help in immune system and does boost up the immunity. But we don't know whether vitamin C actually helps in COVID-19. We're just extrapolating one information and applying it to other. But is there a harm in taking vitamin C? Not if you take it less than 2 grams. So if you take anything less than 2,000 milligram or 2,002 grams a day, that's no harm. And moreover, it's water soluble. Whatever is extra will pass through urine. So largely harmless. So if you feel better by taking it, take it. And but too much high dosages can cause diarrhea or kidney stones. So be careful, don't go overboard. Take a tablet or two, and you can just drop off the topic that I take it and I leave it. And why bother about it and keep talking about it? Whether it's boosting, not boosting, it's not known. People who have been taking vitamin C are also getting infected with COVID. And it cannot save, it cannot shorten, it can possibly do something, and there's no harm in taking, just take it. Vitamin D. Now, if there's any evidence which vitamin D supplements will reduce the risk of developing COVID-19, lacking, completely lacking. So as a hormone, as a vitamin D, it has a dual role. It has a number of roles important for health. So those who have low vitamin D should take supplements and should have a normal vitamin D level in your body. and that's all. Whether it does anything for COVID or not, we don't know. We just should assume that if I am deficient in vitamin D levels in my body, I replace them. And again, so similar to vitamin C, vitamin D, no over toxicity should happen. There's an over toxicity of vitamin D as well. So be careful. Just take a supervised vitamin D the way you should and leave it there. Zinc, zinc is a essential mineral which is required for our body. Again, right amount of zinc in the body is important. And it has been studied, but there is no single paper which clearly says that zinc improves or prevents cold. Otherwise, the cold and flu would have stopped happening in the first place. Even today, cold and flu happens. So we can't extrapolate it for COVID-19, but in general, taking a supplementary zinc, which is not more than 40 milligram, is all right. So just take it as much as this much and then leave it there again. Now there is our age-old Nani ka nuskha, haldi. So people have worked on it. It might enhance immune function, but there's no convincing evidence again. But what's the harm? We've been using it. We continue to use it. It adds flavor, and moreover, it's unlikely to cause any real harm. So the only contraindication for turmeric haldi is, people should, check with your doctor once you are on blood thinners, aspirin and all. So that's what you should tell, that you are already on a blood thinners, and that's what you should know. Otherwise, turmeric per se will not work against COVID-19. No harm in taking as well. Then there is this, it's in India, it's called as Kalmeg, Cariap, and Echinacea. It has been quite a popular herb in North America for prevention of common cold. But there is a systematic review which said that it might have some protection against respiratory diseases, but it does not reduce the severity or the infectivity. So we don't know. It's impossible to say at this point of time, is it any help? But if you are a high-risk person, age greater than 65 and elderly and having other problems, and if you can find this Kalmeg Cariap anywhere, no harm in taking it. It's just a herb. That's how it is. Garlic, we've already spoken. Only and only what you want it for is, don't use it for boosting immunity. Just use it for your taste. Then there's a lot of talk about which fruit, which veggies, which seed. Can I take watermelon seed, and then all of those new seeds which have come up that they're good. Flax seeds, and then there are again conflicting reports. Nobody knows the reality. Multiple studies could not conclude that any specific food will improve immune function. But what I could tell you is that it's common sense. Mix all fruits, veggies, seeds into a balanced proportion. Eat it. As simple as that. Don't go overboard. You can't just keep deep diving. Researchers, scientists have been trying to find that whole magic, food, but they haven't been able to. So you wouldn't do it in your Corona times either ways. So don't dwell on it much. Just have a balanced diet. Again, there's a lot of talk about chicken soup. Should we have non-veg these days? Not have non-veg these days? Eggs, not eggs. We don't know. So nothing. Have a well-cooked vegetarian meal if you feel like. And this is the most popular urban myth that chicken soup will cure common colds and flu. It wouldn't. There's no harm in taking if you like the taste. It's a great meal. There are medicinal mushrooms which I've been spoken about, and people say that mushroom khane se acha rahega. Again, nothing is conclusive here. So There are some medicinal mushrooms which are used in various other medicinal reasons. Whether it will have any effect on COVID, not known, nothing conclusive. You can have in moderation if you feel like, if you like the taste of it. Then there is a lot of recent articles and literature saying fasting and refeeding. I fast for 16 hours and then start. So all of that is also there, but there's again conflicting reports. Nobody knows, and certain foods affect your immune system in a certain way. Whether fasting and refeeding helps, doesn't help, and but there are things which is done, like fasting reduces immune function, but as soon as you refeed it, it boosts and reboots the entire system, and you should do it. But at this point of time during a pandemic, you want to try a fasting and refeeding is not what is advisable. The reason is that we don't know how it functions and what are the long-term studies. What we definitely know over the long-term studies is that a balanced diet every day, a balanced sleep, a balanced workout, a good weight, a good food sugar level, and all of that put together, a healthy body is fine. So I wouldn't try to experiment at this point of time for other things. But yes, there are reports, and I've documented them here. Ketones in the body are good for immune function and keto diets, but I would rather just do what I've been doing as a balanced diet. How to boost your immunity during lockdown? So be active, get enough sleep, eat right, and practice good hygiene. This is the mantra for everybody. Everybody had questions regarding what I should eat, what I should do, what is it? But this is what the bottom line is. Be active, get enough sleep, eat right, practice good hygiene. And then stay home, stay safe, and break the chain, break the corona chain, and that's what is required. It's your own responsibility, not a responsibility of a state government, a bureaucrat, a police official, or prime minister. Don't expect him to do that. That's where we are, and now we can start taking questions.
There's one question of Nikhil Basin. Will this repeat itself every year? This corona will repeat itself?
Till the time, oops, sorry, I don't know where is the, I'm just trying to get the videos.
Okay, so on the top you will get stop sharing, screen sharing.
Okay, yeah. All right, yes. Please.
So the first question is from Nikhil Basin. He asked, will the disease will repeat itself every year?
See, till the time we have a solution against in the form of vaccines and medicines, then we're not sure till when. It can keep happening. See, even one patient is there, one person positive can infect about 400 people. So we don't know. See, it's not going anywhere. It's what it seems till the time we have a vaccine or medicine, or it sometimes just die on its own. We don't know how it will unfold with various temperature changes or anything, but it doesn't seem to be, because in entire world there are different temperatures, different humidity, different things. But if you want a clear answer to your question, as long as there's no medicine, no vaccine, we are looking at strong possibility that's going to be there for a longer period of time.
Saurabh Khan sir, please ask your question. I'm unmuting you. Dr. Saab, I'm trying to unmute Saurabh sir, but there's some problem in his audio. Okay, I asked his question. He just wrote on the chat box. In the presentation, so many good foods have been discussed for which general belief is beneficial and results to our minds are good, but results are inconclusive as per medical fraternity. Absolutely. Don't you think modern medical science should do more research to come some conclusive results and evidences?
Of course. I mean, and why do you think that they're not doing it? Everybody wants a magic bullet of a food. So they are, but they couldn't find it. It's difficult, it's complex, and there are a lot of people who are investing a lot on creating that magic food or coming to know that this is going to work. So they are doing it. Uh, I can assure you that they are already doing that and a whole lot of it.
Sir, there's one question about blood donation.
Mhm.
Should we donate blood right now when there is a COVID
Yes,
you know,
of
danger?
course.
Okay.
There's no danger. See, again, the danger is as good as you not practicing social distancing. As long as you are having your mask, you are having social distancing, you are going to a center which is practicing very safe methods, there's no problem.
Some
It is
members,
as good as going to buy vegetables.
right. Some members are asking about this plasma theory, what it is, and will it be effective, or is there future? This plasma therapy is a
See,
future.
I tell you, I didn't think that something like this is required from a medical book, but any which ways. See, plasma therapy, if to be understood, is that how does it work? The plasma therapy is the antibodies which have been produced in a person who has recovered, and he has the antibodies which he made against the virus. Are you all you understand what I'm saying?
Yes, sir.
So, so once somebody is recovered, he recovered because of a certain antibodies which were there in his blood, which fought against the corona, and he came out a winner. But now this person has antibodies which we are taking out and putting from his plasma and putting across into another person who has corona and has serious corona, and we expect that these antibodies will work against that person, and hence this is the application which is being used. There are a lot of pitfalls. Sometimes given type of antibodies in a given person may not be as effective as in another person.
Okay.
Or actually, as a matter of fact, if you see that now the latest reports are the very person who came out as a winner against corona can get reinfected. So if he himself can get reinfected and he can contract corona again, so his own antibodies could not save him against that corona, then giving it to someone, whether it will help or not. However, at this point of time, we have started plasma therapy because we think that if it has worked in this guy at this point of time, this might work in him. And there's no harm in giving a chance to a potentially very critical coronavirus patient, and we can possibly cure him at this point of time and not worry for the next episode. So that's how it's been effective. There are a couple of people who have improved, and we assume that over a period of time, this will improve further.
Okay. So I've seen lots of people doing morning walk for hours. So what is the correct time to do morning walk, and what should be the duration, and how they should walk, briskly or softly, or how they should walk?
See, again, there's nothing extra strenuous which anybody should do. So one by one, answering your question, nothing extra strenuous. Whatever you've been doing and whatever you can do, the same model of exercise to be applied here. Then, the next is that um, whether morning or afternoon or evening, there is no real study on that. You can do it as per your preference. There's a lot of interplay. What is the temperature, what is the humidity, and what is its impact. But as we know that there's not much difference. Plus, brisk versus uh, not so brisk, or taking it easy, is individual choice, and as long as it is not over strenuous. How long? 30 to 40 minutes is what is recommended as this point of time, and social distancing should be little extra because of the your own speed at which you are, and also you will pass through a certain person, so you should make sure that there is enough social distancing and you are carrying your mask.
Okay. So Manu Malhotra sir asked, why do you say exercise 4 to 5 hours prior to sleeping?
Oh, that because the reason is that your cortisol and your various other, hormones, they are they release and they keep you more active, and then it becomes difficult for you to sleep. So it's wiser that your activity is 4 to 5 hours prior to your sleep time.
Okay. So the next question is regarding the lifestyle disorder disease. What it is, I mean, basically, we chartered accountants, you know, हम अपना समय ज़्यादातर लैपटॉप्स पे बिताते हैं. With the life is full of stress, managing the wealth of others. We are not able to manage our family, but we are able to manage our wealth of our clients. So, what precautions should we take, and what should we do to keep ourselves fit and during long sitting hours in front of laptops?
Now, say it again. What is your question?
Sir, what precautions and what care we should take while sitting long in front of laptops?
See, the large problem is, of sedentary lifestyle is gaining weight and having your neck muscles and back muscles uh, weaker, and a prolonged posture, any kind of posture, or any kind of muscle group is always a problem. Even if you keep hanging your hand in one on one side like this, will also create a problem for your shoulder. So it's the same application, that it's going to affect your you know muscles of the neck, and you might have problems. So neck exercises, back exercises, taking breaks, and keeping the right weight, eating right amount, exercising in between, and that's what is the most important. Even if you can't, there's no magic mantra or a magic wand, or a magic pill which we can give you and tell you that this is what you should do. It's healthy lifestyle which is important. And yes, everybody these days has to sit long hours, work on laptops, work from home has increased that. But you need to take breaks, you need to exercise your neck, and there are various exercises which are available on the net and everywhere else. One can find it and start doing them.
So there's a confusion that insulin, directly taking insulin and the pills, which is better, taking insulin or the pills, diabetic pills?
See, I'm a diabetologist, and this is something which I tell all my patients, and it's a very long conversation. But one has to understand that there is nothing like a preference. It's the requirement of the body. See, what happens is, and I'll quickly try and make everybody understand this. See, what happens is that there is a internal secretion of insulin which is responsible for maintaining the glucose level in the body. Now, if there is decreased, that's when you start getting diabetes. And there are a lot of interplay, but I'm trying to make it simpler. Now, when there is a decreased amount of insulin or insulin sensitivity, what we do is give medicines to boost that enough to manage your blood glucose. But there's a time at which the pills can't work, because there's not enough in the body to keep manufacturing because of the pills as well. The manufacture of insulin is important. So that's the time when one has to shift from pills to insulin.
Okay.
So there's nothing like a preference. It's the need of the body, that it's not a choice. कि मैं pills लूं या insulin लूं. It's the right control of the blood sugar which is important.
Saurabh sir, please proceed for your question.
Good afternoon, sir. Thanks a lot for your kind deliberations on such a relevant issue. It was really an eye-opener for all of us. My question is, can you please share what are the treatments and medicines and food and lifestyle that is being provided to the patients of COVID who have recovered?
Who have recovered? There's nothing
Yes,
special.
yes. What food?
Everybody has to be treating them as normal people. Whatever balanced diet. And why do they don't need anything extra. They don't need there's no drug available. So there's nothing which is there. Just treat them as normal people like you and me.
Symptomatic treatments are being given to them.
Once they have recovered.
No. During the course of their treatment.
Yeah, during the course, it depends on what they have. If suppose they have some very high grade fever, then you might need to control their fever. If they have secondary infections, then you need to give them antibiotics. If they have respiratory failure, lung failure, then you might need to give them ventilator assistance. If they have kidney failure, then you might have to do dialysis.
Okay.
It depends on the kind of, it is like any other illness. We do not have any specific treatment. Whatever the person is suffering from, whatever its complaints are, to make them mitigate those complaints, whatever is required, it's the same medical science application.
Thank you.
Okay, doctor. Thank you so much.
Yeah.
Atul sir, please ask your question.
Yeah, thank you, doctor, for the guidance. My question was like in our offices, we have air conditioners which tend to recirculate the air within. Now, as we start operations, there'll be a lot of strangers coming in, going out and all that. So is it advisable to work with air conditioner or open windows and just fans?
It's a good question. And till now, the data suggests that air conditioning, the home air conditioning, the office air conditioning, do not cause the coronavirus. But a recent study from China only has suggested that the flow of the air conditioner, the air flow, allowed the made them rethink the social distancing when there is a direct airflow of air conditioning, say, which is 6 feet, it should be more or not, but further studies are needed. But expecting the air conditioners to be responsible for spread of COVID, no, as of now, whatever evidence we have now, and people being afraid of thinking that it's recirculating from outside, but the way it recirculates with its the whole thing, it usually does not survive. People have been asking us, even for those who have ducted air conditioning, that should we clean the ducts? So it is not, at this point of time, it is not advisable to clean the ducts. It's not required.
Thank you.
Doctor, there's a last question. Please tell us about balanced diet and how much water we should intake. What constitutes balanced diet? How many times we should eat, and how much water we should intake?
This is actually a very good question, because all the lifestyle of people have actually changed in last 30-35 days. They're staying at home, they're eating anything, they're eating everything.
And
so what do you suggest?
At any time.
So the thumb rules stay the same. You should drink good enough water to keep yourself well hydrated. There is no final mantra that 2 liter hai ki 3 liter hai ki 4 liter hai. It depends on your own body requirement. Because if you are an athlete who goes out for a run for 2 hours or exercises at home for 2 hours, you might have a different requirement. And you have a certain age, you have certain body surface area. So the basic mantra is that your body and your skin and your tongue should be well hydrated. That's one. So asking for a final 2 liter PGA or 4 liter PGA is not the right answer one should expect. Balanced diet, again, depends on you are a 1200 kilocalorie person, or you are a 4000 kilocalorie person, or a 3000 kilocalorie person. What is your body surface area? And all these changes, these are all individualized. Again, there is no one diet chart which is to be followed by everybody. But yes, people come up with the gram of proteins. 1 milligram per kg body weight is the right amount of protein one should take, and 30 to 35% of carbohydrate or fat or protein, and then these percentages keep changing upon that, depending on the body type, is their activities, and what do they do. And despite being home bound or locked down, people might be wondering, but there are different, somebody's muscular, somebody's obese, somebody's. So largely 3 major meals, 3 minor meals, no snacking, a right amount of food in terms of calorie, which is right for you for today. And that's to be answered depending upon your various factors. And that is how one should structure their diet. It is a very important question, but it has to be individualized. You can't have a generalized answer. There are so many people out here, and they might wonder कि भाई मुझे कितना खाना चाहिए. डॉक्टर साहब ने कह दिया 1800 किलो कैलोरी और 60% कार्बोहाइड्रेट, 20% फैट, 20% प्रोटीन. अब मुझे इसको कैसे करना है? That's not the right way. And you should have all kinds of veggies, pulses, grains, everything, throughout the day, your fruits, your water intake, and that constitutes a balanced diet. It can't be defined in terms of कि सवेरे ये खाइए, दोपहर में ये खाइए, शाम को ये खाइए, रात में ये खाइए. So you will have to individualize it, and the common sense prevailing, or you can contact a doctor, a dietitian, and get it individualized.
God cannot be everywhere, so he sent doctors. Sir, on behalf of all the chartered accountants, we thank you and thank every doctor in entire world who are fighting with this evil. I will request all the members to please unmute yourself and please clap for all the doctors who are frontline warriors and fighting with this evil. Please, I request you all to please clap for these doctors. I request to clap for the doctors.
जो भी है वो प्रोसेस है उनका, वो देख रहे होंगे कि आगे चल के अगर कोई समस्या बढ़ेगी तो.
Please, sir, thank you so much for your time. You have educated us with this COVID. And sir, ईश्वर सफेद कोट पहने हुए हैं आजकल हमें दिख रहे हैं. ईश्वर कहाँ दिखते हैं? आप सब हमारे लिए ईश्वर हैं और आपने much, sir. Thank you. Thank you everybody for attending this seminar. Thank you. Thank you, doctor.
Thank you.
Anybody wants to say individually to doctor? So please raise your hand. Sir, DK sir है हमारे पास हैं. DK sir, we request you.
Very thank you, Dr. Mayank, and very good and very informative presentation, and that's very good and very nice to see you today at this webinar.
Yes, thank you.
Rahul.
Thank you so much, Dr. Saab. It was a very good deliberation, and I was watching the YouTube comments. And a lot of people were messaging me that we are watching the entire program with the entire family. So might be around 200, 300 views were there in the program. Right. But still, we would have around 1,000 people would have seen the program live. So it's a great thing, sir. Thank you for coming in and educating us.
Thank you, sir.
Right. Thank you.
Thank you so much.
Yes, thanks.